Hi everyone, my name is Dr. Basra and I'm the Medical Director and a Child Consultant Psychiatrist. So your child has just had a diagnosis of ADHD and you as a parent might be wondering, should I think about medication and what do I need to know? And this is what I'm here to talk to you about. We want to help you make an informed, confident decision around medication. But do know that medication is one part of a treatment support plan, and there are other options to consider when looking at support for your child. One of the most common things I get asked as a child consultant psychiatrist is medication safe? Medication is absolutely safe if it is prescribed in the correct way and you get the right support alongside it. So the most common medication that is prescribed for children for ADHD is methylphenidate, and it is a stimulant medication. And it helps by improving focus, hyperactivity symptoms, and the impulsivity symptoms. So what does that mean for your child though? That means that they can sit longer and do their work. They can complete tasks. They can follow instructions, and they can help regulate their emotions better. What you will notice is an improvement in the quality of life for your child in terms of both academic and home life. Is there side effects with medication? There can be, and I will have to say, it doesn't happen very often, and generally the side effects are really mild. One of the most common side effects that can occur is a reduced appetite for children. But again, this can be very well managed with the right strategies and support in place. In terms of Diverse Diagnostics, we are very strict in terms of following national and NICE guidelines when it comes to prescribing medication. We will ensure that your child has a follow-up review every 4 weeks until your child's medication is stable. And once it's stable, they will need to be reviewed every 3 or 6 months, depending on your child's age. We don't just start medication and not follow up and see how your child is progressing. We want to make sure that the medication is working well and your child's not experiencing side effects. From the safety aspect, before we start medication, Diverse Diagnostics makes sure that all the checks are done. So we take a full medical history. We want to know what other medications your child is on. We will ensure that physical observations are taken in advance, including height, weight, blood pressure, and heart rate. And one of the key things we do at our clinic is we request a GP medical summary to understand your child's past medical history. To get started on medication, a child needs to be booked in for a medication initiation appointment. This appointment is separate from the assessment process. It allows you to take the time to understand medication, how it works, and make sure that you have the opportunity to ask questions. Medication is an important part to consider in a child's ADHD journey. If you have any questions at all, I would ask you to email us or call us. And we also have our aftercare coordinator who would be more than happy to speak to you about the process.